women in their younger age can actually have ischemic stroke. And then it becomes a big question for them whether they should undergo pregnancy. And because pregnancy itself has certain risk of having a stroke, and whether their risk is much higher, and whether it's safe for them to undergo pregnancy, and if they choose to actually undergo pregnancy, what kind of additional monitoring is necessary. And this is a question that's frequently asked from all people who actually practice in stroke. So essentially, that was the motivation, that we always were asked this question, and we never had the actual data to advise them one way or another, or at least give them actual information that can guide their decision making. First of all is awareness and recognition. So for women who actually had a previous ischemic stroke, I think now we have data to suggest that they do actually have a higher risk of having an ischemic stroke during pregnancy, and even the 6 weeks after pregnancy, the postpartum period. So then the next question is that, in terms of decision making, then now they actually have clear information to make a decision whether they actually want to go forward with a pregnancy or not. If they actually want to go forward with a pregnancy, then the question becomes is whether this is a high-risk pregnancy, and this data does suggest that it should be considered a high-risk pregnancy. And there are actually guidelines about high-risk pregnancy. It just does not include the history of a previous ischemic stroke. And then the current guidelines for how to manage high-risk pregnancy, obviously, since it does not have the ischemic stroke history as a component, it doesn't really have the necessary care, triage, or pathways to support that. So essentially, if somebody has a previous history of ischemic stroke, and if they actually want to undergo pregnancy, it should be classified a high-risk pregnancy. Their care should be at a center that actually is geared towards providing care for high-risk pregnancy, has the necessary monitoring tools, and actually treatment tools if necessary, to kind of meet the needs that are required. And I think the other thing is that, when we look at high-risk pregnancy today, there is no involvement of stroke specialists in that particular category. So I think it does actually emphasize that perhaps the high-risk pregnancy team should actually involve stroke specialists or neurologists as part of that team.